I'm Ben. I'm a nursing student from Western Carolina University. The reason I went into nursing is because I knew I wanted to see the benefits of what I was doing. I wanted to see the results of the work I'm putting into the world and to see directly where that goes. And also because in nursing, there's so much you can do. There's so much you can do to really connect with people and to help people. And it's a career that provides so much freedom with where you can be. Especially for me, what I want to do with nursing is to really ensure that the work I'm doing goes to my patients as much as possible. The moment that switched up my perception of the healthcare industry, I think was really when I was coming into hospitals while in nursing school, going to clinicals, and just seeing the amount of patients that some of these nurses had that we were following around and how busy some of these nurses are. And especially in research, in our classes, we learn a lot about how patients really are limited by their insurance coverages and providers are so limited by time limits in which they can see patients. That was what really made that switch for me and made me realize that the healthcare industry works in ways different than how one thinks it might work. This semester, we're learning all about community health, and there's so many people in the community who are afraid to go to the hospitals because they don't know how they're going to pay for it. You know, EMTALA is great about the Emergency Medical Care Act and how, you know, you can get medical care in an emergency no matter what, regardless of ability to pay, but the bills still come no matter what. Some people just don't have the resources to account for that or to be able to take that on. It was absolutely wonderful at the clinic. I was so stoked to be here. I always knew that I wanted to put time in at free clinics when I became a nurse, and coming to Rams today magnified that a million times. I never realized it was this effective, this efficient, this functional, and this collective. And it was really motivating to see that, to be able to work in triage today and get patients checked in and understand their health history and point them to where they need to go. To be able to go to medical and be alongside providers, figuring out what's going on with these patients who cannot go to their own doctors, who don't have doctors because it's so expensive now, and to figure out what's going on with their health conditions, what they need to go from here, and seeing the amount of personnel in the dental area. There are so many professionals, so many doctors, so many students, so many assistive people in that to really make it work like a well-oiled machine, and it is beautiful to see. These are the kinds of things that before coming here today I thought could only be done with the support of a business. And today I realize that the people can make this happen, and they can make it happen just as effective, just as well polished, just as cleanly as a business can, due to the community coming together and making those efforts happen. And so that has really been pushing me forward today. I've had some great experiences with a whole lot of patients and a whole lot of people, really just getting to see the people who need care the most and getting to provide them. Because dental and vision care are so blatantly not covered by insurance in America right now. So many work plans don't cover dental and vision, and it's so hard for people to get plans like that, especially of the working class. So to see these services provided completely free, it was amazing. It was so cool, and it's something I want to be a part of.